Good afternoon, everyone, and welcome to today's webinar. Thank you for joining us. We will be exploring today the impact of the COVID-19 crisis on social care. So it's fair to say that during these uncertain times that it has never been more important for our public sector to have a strong and robust social care system. COVID-19 will have a legacy that will be felt across the sector for many years to come. We've pulled together a panel of experts today that will explore what is next for social care and what needs to be done to form a successful response to the crisis and beyond. If you have any questions as we're going along, there is a Q&A facility built within Zoom. If you want to pop your questions within there, we will get round to those questions at the end of the session. If we can't answer all the questions during this webinar today, we will be sending them out in a transcript to everyone immediately after, so all questions do get answered. So I'll now start by introducing today's panel. So my name is Adam Crampsey. I am the Managing Director of Bloom Procurement Services. We are an organisation that work with all public sector bodies to deliver outcomes across all sectors of the public sector, including the NHS, local authorities, central government and education. We work with around 370 public sector bodies, and we deliver those outcomes through the NEPRO 3 framework across 20 categories of spend. Health and social care is a particularly large area of the framework that we cover, and we've delivered a lot of projects through local authorities in the social care space. Through Bloom, you can appoint any of the suppliers from our 6,500 supplier large marketplace to deliver your requirements in a compliant manner through a procurement route, but also delivering those vital outcomes, particularly in the social care space. Next on the panel, we have Mike Farron, Customer Development Manager for Bloom Procurement Services, who will give you an introduction.
Thank you, Adam. Yeah, Mike Farron. I'm a Customer Development Manager covering the Northwest, but my expertise in social care around adults, children's and public sector, public health contracts. So my role is to pull together or help to pull together specifications and procurement documents for customers, and then work with both customers and suppliers around the projects and making the deliverables and outcomes for the end product. Thank you.
Thank you, Mike. Next on the panel, we have Simon Whitaker, Head of Strategy and Performance for ICS Assessment Services.
Hi, thanks, Adam. ICS Assessments is one of the UK's largest health and social work organisations. We provide statutory public services to local authorities and CCGs, particularly focused around adults and children's social care. And we support around 10,000 recipients of social care a year, conducting Care Act reviews, continuing healthcare assessments, children's safeguarding services right from the front door, all the way to looked after children and permanency services, and deprivation of liberty safeguards as well. We're in our 6th year as an organisation, and we've really seen a huge increase in demand, particularly around strength-based services, maximising independence and working towards re-ablement and use of technology as well.
Thank you, Simon. Next on the panel, we have Kirsty Jordan of the People 2, the Service Director at People 2. Kirsty.
Hi, I'm Kirsty at People 2. People 2 provides support to organisations across all local government and health services. We work to design and implement affordable and outcome-focused services. Since 2009, we've worked with over 100 local authorities and health organisations across the UK on diagnostic projects, service redesign, implementation, practice and culture change, and digital transformation. We are hands-on and have significant operational experience. We work alongside staff at all levels to deliver change. Our work results in financial efficiencies and long-term sustainability and ultimately better outcomes for people.
Excellent, thank you, Kirsty. Next on the panel, we have Richard Parkinson, the Director of Farpoint.
Afternoon. As I say, Richard Parkinson from Farpoint. We are an independent technology consultancy. We've been going just over 10 years, and we deliver projects for public sector bodies across the UK, helping them develop strategies to look at how they can use technology to improve their services and how those services are delivered. And we also work alongside organisations as a trusted advisor, helping them through the process of buying and implementing technology. In social care, we've been involved in a range of technology-enabled care projects, with particular focus recently on looking at digital telecare, helping organisations make the move to digital telecare and making the most of that technology once they've got it.
Thank you, Richard. And then finally on the panel today, we have Sue Fadipe, who is an experienced consultant and social care senior manager. Sue, who was having some technical difficulties with connections earlier. So now I'm slightly filling the spot potentially. Yep, looks like we're still having some technical difficulties there. So we'll come back to Sue as we progress. Thank you. So what we're here to discuss today is around the impact of the COVID-19 crisis on social care. It's fair to say that the social care system was already suffering from a funding shortfall and challenges prior to COVID-19, which have somewhat been exacerbated by this crisis. The Local Government Association warned of an adult social care funding gap of 810 million in 2020-21 financial year. And this is set to rise to around 3.9 billion by 24-25. At the end of the spectrum, at the other end of the spectrum, we've got unprecedented demand and funding shortages have combined to put councils' children's social care budgets under increased pressure. New analysis by the LGA said that these pressures have forced councils to overspend on children's social care budgets to try and keep children safe by more than £3 billion in the past 5 years. So fair to say from that analysis that there were some very big challenges in the social care space prior to COVID, with that then further exacerbated by the crisis that we're currently in. Which takes us on to our first question, which is what impact has COVID-19 crisis had on a system that is already experiencing issues with a lack of resource? So Mike, could you just give me a bit of an overview from your perspective, what your customers and the people you're working with are saying around what the impact of the COVID-19 crisis has had? Mike, I think you're on mute. Sorry, apologies.
So I am. Thank you very much. Yeah, so we're finding at the moment everything is very reactive due to obviously the unprecedented times and needs. But they're starting to come through that now and look at the proactive approach. There's going to be a huge backlog in demand. So doing assessed needs, things like that. So it's very much not business as usual at the moment. Obviously trying to get PPE, trying to get people safe, and other priorities are taking place, but will be business as usual. So there's huge resource issues obviously across social care, and always has been, but there's sickness as well across the staff now. So about 30% is being reported due to this. So it's affecting everything across the whole system. There's also recruitment issues, so trying to get temporary and long-term social care workers into place. There's the training issues as well, so we're trying to get people back into the sector who've left the sector. So there's just demand everywhere, and obviously there's fingers going in dams, but there's the dams bursting. So hopefully, as we get through this, we can look at the demand and then take that forward from then on.
Thanks, Mike. And I'm just going to hand over quickly to Sue, who I believe is now back online. Sue, hope you can hear us. Sue, from your perspective, from boots on the ground and working in local authorities, what impact have you seen has been on the crisis on social care? Sue, I'm not sure whether you heard that question or I've got you online. No, I can see some activity. So while we're waiting for that, I'll hand over to Simon. Simon, from your perspective, from ICS.
Yeah, and you know, I think it's been a bit of a tale of two cities, if I will. In health, I've just been kind of reflecting on some of the stuff, particularly in the news that we've seen in the last kind of 6 to 8 weeks. But you know, in health, we've managed to kind of overcome barriers that should have really taken us years to overcome. You know, in a spate of 2 or 3 weeks, We've had huge discharges from hospital. That obviously brings pressures in other parts of the system. But that's the kind of thing that that we've been able to, at least from an acute hospital services perspective, we've been able to push through. DTOC is now a historic term. If you look at the kind of numbers and the the bed capacity, not everywhere. Obviously, we've had challenges in London and up in the northeast. But other parts of health system, A&E admissions have dropped by 20%. That's down to what we kind of had back in February 2010. Not all appropriate, reductions in demand. I mean, we're still. It will take us a long time to figure out, whether we're losing need. There's kind of unmet need out there from the reduction in A&E admissions, and other people that are deselecting from coming into health from coming into health services as well. I think in terms of integration, we've seen a lot more conversation around the room, particularly in local authorities, and providing support to care providers. So there's been lots of examples in terms of commissioning support, so fast tracking placements, offering faster payments, and pay up front, and looking at paying for voids in residential care, and looking at paying for uplifts in home care, and obviously the 1.6 billion from the government has helped with that. And I think the area where we probably need to do a lot more work, and I'm sure we'll come on to this in further down the webinar, is around understanding what we've done differently, what we've done better, and what we should carry on doing. I think that social care initially took a bit of a back seat, but it's been incredibly pertinent now, particularly we see a lot of news around care homes, around PPE support. I mean, the CQC had launched their emergency support framework as well, which has helped them give a lighter touch, but a more supportive, quicker kind of way to getting that support in terms of infection control, PPE, the things that they need. But actually it's about saying, okay, well, we need to keep some of these things for the future. There might have been things that we probably should have been doing before, but we needed a crisis to get us there. And I think that's really where we are at the minute.
So from your perspective then, do you think there's definitely going to be a place for some good reflection to do that learnings from this to take forward?
Yeah, and I'm sure my colleague Kirsty will attest to this. Sometimes you get big transformation programs, and all sorts of departments say, okay, we're going to launch on this big project. It's going to take us 6, 12, 18 months. Things that we've kind of now seem to have overcome, albeit not in a necessarily a structured, documented, monitored way, but we've overcome them in a matter of weeks. And actually, the difficulty is. Culturally, I think changing people back to, okay, well, let's not think in terms of getting back to where we were before. We've got a bit of a break point now in the system where we can say, well, actually, what do we want to carry on doing in the future, particularly as demand across the system has just changed completely.
That probably segues nicely into you then, Kirsty. If from a people to perspective, with transformation and regeneration and new ways of working is a big part of what you do you see that the impact of COVID-19 being some positives there for what you deliver?
Yeah, absolutely. And I think everybody else has kind of said it. I think at the start of the crisis, there was a lot of transformation put on hold, a lot of things paused, and a lot of very reactive work, which was absolutely what we needed at the time. But I think going forwards, there's some absolute opportunities. There's been a lot of impact, some of which is negative, but some of which actually, as Simon said, there's a lot of opportunity to think what has been done differently, what might the different needs be in the future, and how can we build on that. I think the kind of full impact of the crisis isn't known yet by a long way, and I think it's going to be quite a while before anybody fully understands what the impact is. And I mean, it's obvious that there's going to be a financial impact, and a really big one for a lot of local authorities, not just in what they've had to spend in responding to COVID, but also in some of the savings delivery they've lost. I think, as Simon alluded to, there's going to be a bit of a change in demand, and we don't really understand what that looks like yet. the kind of stability of the provider market. We need to fully understand as well. I think a lot of local authorities that we're working with are very worried about the sustainability of that provider market and their ability to deliver sustainable services going forwards. We're seeing a lot of our clients now starting to look towards the future and considering what approach they need to take in shaping that market. I think we're going to see some quite different approaches to service provision going forward, quite a move away from some of the traditional residential care and building space day services, and we are already seeing our clients start to think that way in terms of transformation. Again, integration with health, there's been a lot of joint working, and as Simon said, a lot of things have happened very quickly, but some of those things we might want to build on and think about how we deliver things differently going forward.
Thank you. Sue, I'm just checking in to see I've got you online now.
Yes, I'm here.
Wonderful, thank you, Sue.
Sorry.
So can I just, following on from Kirsty's point there around the sustainability and the demands and challenges that are there, from a service user perspective and from being on the front line and doing what you do, what impact have you seen from the COVID-19 crisis?
I've been thinking about this all morning, really. I think the impact's massive, but I don't know if it's quantifiable yet. So when Kirsty was speaking to people know what we know, I don't think we do. I think we know what happened at the beginning and we all had to respond differently. And I'm speaking with a more children's services, social care services hat on, and also education hat on. That was responding to what happened. But now the unquantifiable bit is, the biggest challenges is, what will children return to school? How have these vulnerable children been managed? Are we concerned? How has, and the other one is, how has this time away from the office affected the workforce? So if you look at all the different professional bodies, it's very much about how have you managed at home? Has it been very stressful for you? And then you also get, isn't this better? Isn't there better ways of working? I think the other challenge, which has been embraced now, I hope, is using different digital platforms to manage meetings and to do things a bit more effectively and cost effectively. It's certainly worked with partner agencies. It's certainly worked with people who work in one hospital and we all need a meeting in another room. It's now done via Zoom or other. Well, that's a challenge in itself. Which platform do you use in terms of what local authorities' data protection rules fits each platform? So there's challenges operationally, but the quantifiable bit is how you work forward. What the challenge is what will be at the end of this, because it is a long period of time, and how we manage that. And the other challenge is that both for in terms of adults with the Care Act provision and the Care Act being changed and suspended somewhat, and also the amendment of regulations for children. So there's lots of conversations about, isn't that awful, isn't it terrible? We've lost an extra level of scrutiny, and there's conversations that say, isn't it about time we were less bureaucratic? And I suppose that in itself is going to be a challenge about how we manage going forward. Thank you.
Richard, probably a good segue into you from the point there that Sue mentioned around the digital side of things and the use of technology. And so from your perspective, where you're dealing with your customers in a social care area, what impact has been felt there that's related to the technology side of things?
I think there's definitely a theme through all of the contributions here that you know we as well have seen a real willingness from care providers to think differently about how they actually deliver their services, and for us specifically, that's the role of technology and in service delivery. In some cases, we've been talking to organizations for quite some time about some of the benefits of technology-enabled care, and whilst they've been able to see the benefits, they've maybe struggled to implement them at a scale, just given various kind of organizational or operational challenges. And then kind of COVID came along, and we saw some of these challenges kind of swept away seemingly overnight, and some of this technology put in place in very short timescales. Equally, we have seen where some organizations have wanted to think differently about how they deliver services, and where they have been constrained in their ability to kind of adapt their services because of the technology, being reliant on some older technology, or just the fact that they don't have that technology has limited them in some in some cases as well, where they've been looking to maybe use technology to share service delivery between different parts of the care organizations, or between health and care, look at things like automation and things like that, where that could have delivered some benefits. They have been constrained in some cases.
Thank you. So that's a look around the impact of COVID-19. I think we probably touched on the next question, some of those responses, but just to delve back into that, around some of the real key challenges that the clients have faced, both the clients and both your organisations during this COVID crisis. So I'll probably go over to Kirsty first. Kirsty, from your perspective, so what challenges are you seeing, if you to narrow those down to the key ones?
I think definitely going forward, there's going to be financial challenges, as we've all touched on. I think all councils are going to see some really big pressures. I think we've touched on the ability to kind of weigh up their need to respond now and throw all their resources at the response to the crisis, but also the need to look to the future and make sure that they can come out the other side of this, and that services are still there and sustainable. I think thinking about the workforce, and actually there's a lot of staff that have been working extremely long hours, extremely hard, but actually they have really come together. We've seen a lot of our local authorities saying actually that there's been a lot of real strengths-based and creative practice during this time, trying to deliver solutions for people that meet their needs and personal outcomes actually in a really difficult situation. So for example, you know, local authorities have had to close their day centres. A lot of people have had to have their care and support reduced for various different reasons, and that's had to be delivered differently. We're seeing social workers doing assessments and reviews virtually, and I think whilst that's been really challenging, I think it has also shown that the sector is really resilient and it can create solutions to these challenges. And some of those things, as we've said, I think will have an impact for a long time to come.
Thank you. And on that topic of resilience in the face of challenge, Sue, how has that been manifested, and how have you seen that in the front line?
I think there's, I agree with Kirsty, there's lots of people doing things differently and better. I think there's an acknowledgement of more working together. Certainly I've got good examples of the schools that have remained open, working in partnership with colleagues, you know, not just social workers, people from early help. It's a very different approach people have used. I think some of our health colleagues who'd normally be in the front line with us have been seconded into other roles. So lots of health visitors are actually in hospitals, but they're still able to provide some information, or they've come up with other situations, they've come up with other ways of getting that information. So there's lots of positives and acceptance from people, which has lessened that competitive tension with partners, I think. I think though one of the things that we need to think about is effective safeguarding for anybody who's vulnerable, because I do accept that virtual reviews, virtual visits actually work better for some kids, but is it effective, and do we know if it is or not? And what from this type of what we've done well and are able to do consistently, and often to the families or the young people's their choice, I don't know whether we deliver on our regulatory requirements sometimes.
Okay, interesting point there. So whilst it works for some, there's still a challenge there that impacts others, where that advancement in technology and doing things differently isn't a one size fits all.
Yeah, I also think the other thing for children nationally, a bit different where I am in the south at the moment, is placement choice is massive. So even though this scrutiny bit has been released with the new amendment children's regulations, there's still so foster carers could get approved quicker, we can place children with family quicker. There are still massive issues for those children who are more difficult to place, and for those kids where because of the virus, lots of establishments couldn't take them anyway. So that's been a massive challenge. And there's lots of different work being done regionally throughout about how to deal with that differently. So there's something we can learn from that, I think. But that is still a great big challenge. And indeed, more children may come into care after this, and how we're going to manage that.
So Simon, if I just follow on from Sue's point there, that we could be facing an awful lot more demand in a system that was already really challenged by the demand pre-COVID. From your perspective and your clients, from a staffing perspective, and what ICS is feeling with their clients, could you give me a bit of an overview there of those challenges?
Yeah, I completely agree with Sue in terms of her experiences in children's services. We deliver children's safeguarding services across the country, certainly where we've been working currently. It's been difficult to kind of say, well, how do you understand the situation that's happening in someone's home if you can't cross the threshold? And it might be, it might be a choice of the family, or it might be a choice of the authority to keep people safe. But it's incredibly difficult to say, well, is that family being supported properly? And for our remote teams, we've had to overcome those same barriers, and what Sue mentioned in terms of gathering information in a different way, getting into kind of community networks and talking to people around the community has been quite helpful with that. But we've done other things which have been able to reach out as well. So the offering kind of food parcels, and we even ended up giving a bike to one of the support workers so that they could support their service users. Obviously couldn't go on the bus. So, there's other things that we've been able to do that have tried to kind of maintain that connection and obviously keep up with our statutory duties. I also agree that lack placements are going to be a big issue in future. There will have been some movement around the country, and particularly where people might have been supported in education, and that might have ceased if it was a kind of residential joint education placement. There'll be difficulties in terms of how do you get people re-engaged into, or children re-engaged into those kinds of environments where, you might have worked for weeks and months to get them in that space already. There's probably going to be a bit of an uphill climb to get back to that as well. I think one of the biggest areas initially where that presented us with difficulty in working with clients was around dolls. So we support a number of authorities with best interest assessments and mental capacity assessments to people in care homes. Now, it took probably a week or two longer to get the dolls guidance out from the initial Care Act guidance. But we were already working with councils to say, look, we need to be able to deliver this remotely, and we had to use our contacts. We speak to people that are working on developing the new LPS framework. We've got contact with training providers that do best interest assessments and barristers as well. So we're able to say, look, there's got to be a way that we can do this legally and complete our legal responsibility without necessarily crossing the threshold into a care home. But actually, it's more important probably now than ever if we're talking about restricting people's ability to make choice, to have choice in the care that they're given, if they're in a care home that is not allowing visitors, so they can't see their friends and family, and they are subject to the types of infection control and controlling measures that care homes have to undertake.
Thank
you. Yeah, lots of challenges.
Lots of challenges. So moving on then from the challenges we've talked about there, just going to drill down into some of the solutions that have been able to be offered on this during the crisis, and also kind of working up to this crisis that you were working on prior to this. So I'm going to go to Kirsty first. So from a people to perspective, Kirsty, what have you been able to offer to the public sector during this crisis and in the lead up to?
Yeah, I think it's been really interesting for us. I think a lot of our kind of transformation work has very much changed. As I said at the start, particularly in the first few weeks, we saw a lot of transformation work paused, and we moved very much to supporting clients to develop their response to the pandemic and to deliver some of those critical services. So that was very much around, we did some work supporting them to redesign their front door processes. We've supported them with kind of project management of the response, looking at how they can maximise some of those hospital discharge processes and their reablement services, thinking about how they can ensure kind of good professional practices maintained and respond to some of the changes in legislation. I think we've seen digital being a key part of that over the last few weeks as well. I think one of the particular highlights for us of the last few weeks was being successful in obtaining some tech force funding, which we've used to develop a volunteering app, and that's been really successful in supporting recruitment, management and retention of volunteers. And I think that's something we're seeing significant interest in across the sector, about how they harness and maintain the volunteering resource that they've seen and how they use that to support their services in the future. I think over the last few weeks we've started to see councils really start to think about the future and recovery and future transformation. So we're now starting to see a lot more of our work move into the kind of service reviews and transformation planning space again. I think that looks very different to how it did pre-COVID. I think, as we've said quite a lot on this call, there's very much a need to reflect and to think about what the ambitions were before, the impact that COVID's had, some of the things that have been done during the pandemic, that actually some of those things we might want to build into our services going forward. We might not want to go back to the old way of doing things for everything. I think, again, some of the significant savings that the councils are going to have to make and the financial impact going forward, some of the challenges around the external provider market as well, considering that the differences in demand and what future demand and need might look like. So I think some of the challenges going forward are going to be similar, but also different to what we were seeing pre-COVID and during the COVID pandemic. And I think it's now that very much that point about councils being able to reflect, to think about what's happened before COVID, what's happened during COVID, and how they're going to take that forward.
Thank you, Kirsty. And just a quick follow-up on that one. And so you mentioned there that probably your business model and your diagnostic model that you had, a very tried and tested model you've done with lots of authorities. You see that changing as a way in which you're working in the future as a result? So you as a business will reflect on this?
Yeah, I think so. I mean, very much our diagnostic model is very much about understanding the baseline data, engaging with the service, understanding the current position of the service. So I think, although the challenges they're identifying and the solutions and recommendations that might be within those diagnostics might change, I think the approach is very similar. It is very much about analysing the data, benchmarking, understanding that demand, understanding the financial position, and really understanding the service, engaging with staff at all levels. I think there's definitely going to be a lot more reflection during that and kind of engagement with staff at all levels to actually understand how they experience things on the ground and what has been different during this time. So yeah, I think some of the kind of outputs of those reviews may look different going forward.
Excellent, thank you. So moving from the transformation side of things and diagnostic through to the sharp end, Simon, at the sharp end of things, what solutions have ICS been able to offer to authorities during this time?
Yeah, so I think firstly, just addressing the Kirsty obviously mentioned how you asked Kirsty how her business model had to adapt, and ours is pretty unique in that, you know, services are only paid for when there's an output or an outcome. So we're not sending staff in to support in any way they can, and you know, it's not a kind of time and motion model of delivery. So if we can't fulfill the specific purpose, i.e., you know, there are no care reviews, people can't cross the threshold, then there's no service and there's no business for us. But actually what it's allowed us to do is be really, really flexible. So we construct teams. You know, we've got about 250 practitioners, social workers, nurse assessors, occupational therapists around the country, and they're typically kind of multidisciplinary teams. But actually what we've been able to do is be quite flexible in the types of services we deliver. So a couple of authorities that where we've stopped delivering care act assessments, and in particular one we moved from the kind of traditional model of review to supporting their home first team with hospital discharge services. So people that had been pulled from hospital, you know, they were getting their support and social care in rapid fashion via the council's home first team. We could do the checkup, we could do the social care review that sits behind that. So we'd do a follow-up call 24 hours after they'd been discharged, check that everything was stable and sustainable. we do a 21-day follow-up to make sure that, you know, there was some reablement there was some progress towards, you know, being able to stay at home, because obviously the last thing that anyone wanted to do was to go back into hospital. And then from then we could actually start to complete that Remote Care Act assessment. So, you know, we were able to say, look longer term, but actually it was a rapid kind of change from, you know, the bread and butter grind of just completing a kind of annual review. I think one of the other areas that we've been able to report is rapid triage of individuals. So, and particularly, I think we've already mentioned on the call today around provider kind of fragility and sustainability in the market. We've been doing work around telephone reviews with individuals in terms of understanding the risk of where they might be. So, you know, if they're at a high risk of contracting COVID, then we're able to kind of rag rate them a red and say, okay, well, here's a support measure that can be put in place, and then we can work with the local authority to deliver that plan and say, this is what we need to do here. But then we're also able to identify, you know, where there's, you know, someone might be relatively safe, you know, they've got lots of home support, friends and family network that can deliver care, or you know, can deliver whatever they need basically, and we're able to say, look, they're in the lower risk category, but actually longer term, as people move back into the economy, you know, people start going back into their offices, back into their normal lives, then we know that there's another way to support them then. We do kind of diagnostic work up front as well. So, you know, we try to be quite consultative to say, you brought us in to address a specific issue, but actually what's the thing that effectively will stop you from needing us again? So, you know, if we are working on adult social care reviews, or if we are working in children's safeguarding, we'll say, what's led to this demand? So let's come and have a look at your front door. You know, we'll look at the data, we'll look at the information, and we'll say actually that there may be process and system challenges elsewhere that we're able to address as well, and say actually, you know, that will help reduce your demand in the future.
Thanks, Simon. Sue, I'm going to link that into yourself now, because the next question is going to be directed to yourself from a service user perspective. But actually, listening to what you've just heard there from Kirsty and Simon, and link that into the question around what innovative solutions have been pitched to you from suppliers or from other authorities or from all the people you work alongside that you've seen maximum potential benefit from.
For me, it's not from providers. It's and I think it's what everyone's saying. It's how people have worked differently, but together. And we can't lose that at all, really. So certainly there is IT solutions that have been pitched to us both internally and also by using different organisations, using what issues they've got. There is issues with local authorities and data protection rules that are ridiculous in my view. And that does prevent things. It is really provided a challenge to those people, because it is seen as being such a positive way of working. And so for me, it's more and better efficient digital solutions that we need, which will always go down well. And we've had lots of them. There is something around how we're going to work stronger where I am currently at. There's strong partnerships with schools, but it is essential, because it's not about a demand to the front door in social care, is it? It's about a demand to all children who are everywhere and how we manage their needs in returning to school. So very interested in looking at what sort of trauma training is around for teachers, for people to manage things in schools. There's family group conferences in this sort of restorative model. How are people going to manage that instead of becoming, Tommy won't come to school? Well, if Tommy met with his friends because they're all a bit worried about going to this new school, it might manage. So there's lots of different ways to deploy what are skills now, maybe earlier and differently. And so that's worked, and there's been a little bit of stuff from the DFE around that, and we're collating stuff about how things will be managed differently and quicker. But there is still that underlying issue that is not been removed about vulnerable people, about domestic violence, children, adults, people with any vulnerability, and also that almost problem if it does indeed become an even bigger, greater number of kids who end up in care. And the solutions are around how that doesn't happen, really, and what can we do at the beginning better, as soon as these kids are leaving it that so-and-so hasn't been to school, could be for 8 or 9 months. This will be a smaller amount of time.
From your experience, Sue, and what you're seeing, what sort of activities are currently being undertaken to look at that potential swell in number of cases of children going to care potentially?
So, well, because so we've had to, for the DFE returns, you've got to do COVID returns. So you were saying how many kids, because the vulnerable children were all offered school places, have they gone, have they not gone, is it quite correct they went, shouldn't be people given a choice, all of those arguments are there, but we are returning who's been seen, who's not been seen, who are we concerned about. So some kids on a child protection plan, everything's there, everyone's concerned. There will be some children we were less worried about before who will be more worried about, and they're the type, so they might have gone from an amber rating to a red rating. So everybody, all local authorities are having to prepare themselves that way. And certainly schools are individually, they're phoning up parents, they're in touch, certainly the parents of kids who they view as vulnerable, who are they most concerned about, and they're feeding back to their school clusters as well to try and identify the cohorts of children where maybe they may need a little bit more support.
Thank you. Thanks, Sue. Richard, I'm going to hand over to you on this one because Sue mentioned there quite a pertinent point that there is a need for, and I'm going to use Sue's exact words here, more and better digital solutions. And I'll stop at that point before you go into the data protection side of things that you mentioned. But from your perspective, Richard, what role can that digital transformation, and I know that's a very broad term, play in that creation of an effective COVID response now and in the future to help with the demand that's coming?
Okay, so as I said earlier, I mean, we've been working on technology-enabled care projects for a while, and I think that we've not seen new technologies coming along as a result of COVID. What we have seen is an accelerated take-up of some of the stuff that we were already looking at. So these are technologies that are aimed at either introducing new services for users or improving the services that were already being delivered, or helping service providers themselves deliver more efficiently. You know, the start of a global pandemic is not a great time to start kind of undertaking large-scale technology change projects. So a lot of the solutions that we have seen used in technology to help to respond to the crisis have been relatively straightforward from a technical point of view, and I think that's kind of a good point to make about technology-enabled care just generally, is that, you know, it's very easy to talk about technology and care, and you know, it's not always about spending huge amounts of money on equipment and services and boxes with flashing lights and things like that. In a lot of cases, it's about making best use of the technology that you've already got, and increasingly as well, there's potential for making use of technology that users themselves have. We're seeing more and more technology in the home, even amongst some of the kind of the demographic for care services as well, smart devices and Alexas and fitness monitors and things like that you can use for delivery of care services as well. But a couple of specific examples of where we've seen technology used to help respond to COVID, and both are kind of from the work that we've done with telecare recently. I think as was mentioned earlier, I mean, one of the impacts of COVID has obviously been on staff absence and things like that, and a lot of what we've seen with some of the organisations that we've been working with is staff having to self-isolate, not actually ill, but having to self-isolate, and the technology in some cases has meant that those people are based at home and haven't been able to work. So what we have seen is organisations putting in place remote access solutions to enable the staff that are based from home to be able to take telecare calls, and that's obviously helped a lot with kind of easing with some of those staffing pressures, and in some cases as well in helping telecare services broaden their offering a bit to enable them to take some of the pressure off of other elements of the care services as well. And that's really kind of the second example, which is we've seen organisations move to a more proactive care model, and again, this is something that's been looked at for a while, but we've actually kind of seen it put into action now. Telecare services have as you'll be aware of historically are quite reactive, where the service will effectively wait for someone to make a request for some kind of assistance. So this turns it on its head and is using the telecare service to make regular calls out to the users, and we've seen those used for a number of reasons. We've seen organizations doing that to just do well-being checks with users, where they will call people up on a regular basis to check they're happy and healthy at home, see how they're doing with the shielding arrangements, whether there's any issues with that. And that's provided peace of mind for users and their families that there's someone keeping an eye on them. And it's also helped tackle kind of loneliness, which is an issue during COVID, but was an issue for long before that as well. And we've also seen these proactive calls be used for to replace some kinds of home care visits as well, where they will use a telephone call in place of a physical visit to someone's home. Obviously taking the pressure off of home care, and also helping to reduce the risk of having to go into people's homes and breach shielding, etc. It's not suitable for every user, but where it is suitable, we've seen it being used in place of some of the physical checks that were previously done for things like going in and well-being, medicine reminders, meal reminders, and things like that. So we've seen those used. I mean, taking proactive calls to its next level would be looking at things like preventative care, which is something that a number of organisations we know are very interested in. But to be honest, we've not seen that used too much during COVID, and I think this is down to the kind of desire not to start implementing huge amounts of technology during a pandemic. But that's definitely another area where I think there's going to be a focus from care providers in the future.
Thank you, Richard. Sounds like there's an awful lot there that could be offered, but like you said, not a lot of new things there, but a lot of better adaptation of what's currently in play and better utilisation of that across the board. Definitely. Great, thank you. So just going to finally bring it round to the last question for the panel, and what I'm also going to do is going to weave in some of the Q&As that we've received throughout this as well, to try and answer those. So, what will be the legacy of COVID-19 on social care? And as I say, I'm going to go around the panel and I'm going to weave in some of the questions that we've received. Mike, I'm going to come over to you first around what the legacy of COVID-19 will be on social care. But when you respond to that, can you just weave in an answer to a question received around the impact that we've seen from a procurement perspective and the procurement behaviour in social care space as a result of COVID-19? And the question here relates to, on one hand, you expect to see an increase in short-term distress purchases, but given that the crisis has driven transformation behaviour, is it translating through to procurement activity?
At the moment, we're not seeing a great deal of social care procurements coming through. As I say, it's very reactive, and councils are just getting on with it and doing, literally writing an IOU to get services in. What we're seeing now is we're coming to the end of the tunnel, so we're getting a lot more proactive kind of procurements coming through, and a lot more expressions around how they're going to deal with the outbreak and how they're going to get through this. So we're looking at more around about the September, October time period of reopening things. So it's how they're going to move forward, how they're going to transform, how they're going to welcome members of the public in, how are they going to deal with social care, and from the front door right the way through the pathway. So it's very much, yeah, we're dealing with the reactive at the moment, but it is getting better, and we are looking at the future.
Excellent. So you do feel there's a bit of a wind of change coming with regards to people getting back to some sense of or semblance of normality?
Yeah, and I think it's understanding the financial pressures as well, and what the government's going to provide for them. Obviously, there's the 1.6, and then I think there was another 1.3 billion provided in the social care market. But I think it's very much an understanding that social care is important, and I don't think it has been seen as such previously. But I think it's very much at the forefront now, and especially around domestic, as Sue alluded to before, domestic violence, public health contracts, obesity, things like that. There's a backlog, and there's things going to be happening. and they're going to need to catch up sometime. So yeah, it's very much deal with it now, but we are looking at the future.
Okay, thanks for that, Mike. Kirsty, I'm going to come over to you now around the legacy of COVID-19 and social care. And unfortunately, you're going to get the clangor of the question we've received as well, which is around that legacy piece. Do you think that COVID-19 is going to have a negative impact on the future plans for an integrated care system?
I think that's a really interesting question, actually, because I think one of the real areas of opportunity that we've seen a lot of our clients talking about is actually better joint working across partners and better joint working across health and social care. And I think Simon alluded to it earlier when he was talking about DTOC as well. And actually during this period, organisations have been working really closely together. They've delivered things within weeks that normally would take them years to do. They've put in place some really innovative solutions. And I think frontline staff have worked more closely together as well. I think the system in some ways has felt more joined up. In other ways that there's been real challenges. So some of the challenges about, and I think someone alluded to it earlier on, about social care being seen as kind of a secondary service to the NHS in some of the press and in some of the way that the information's come through from central government or the way that funding's been allocated. So I think there are real opportunities for health and social care to work more closely together. What that looks like, I think, will be really interesting, because I think some of this period has proven that actually what the best way forward is actually to get onto the front line and to deliver some of that change and almost remove some of that bureaucracy and governance and some of the things that have actually been slowing integration down for a long time. So I think it will be, time will tell. I think it definitely should be. We should be looking for health and social care to work more closely together. I think how we design and deliver that is yet to be seen.
Definitely. Sue, can I just hand over to you to follow on from that point from Kirsty, and also just weave in around this a question we've received around, do you feel that there will be a change to thresholds during this period, particularly as organisations have become increasingly risk averse?
That's a hard question. I really don't know. I actually think, so the first thing is, what's the legacy is, change is the new norm, I think. So everyone says when we go back to normal, we will not be going back to normal. I am really clear about that. For people who work in local authorities, this business that everyone's working from home is amazingly different. Even if you've always had agile working, even if people have always took their time. So there's issues about what will be what's the legacy. Nothing will be normal for a bit, I don't think. So in terms of how that affects thresholds are thresholds. They shouldn't be in any way. How you manage risk is another question. And that's about what we were talking about before. And I think what all people have alluded to this afternoon, if you know what the issue is and you deal with it in a more proactive sense with partners on an integrated basis, that means you deal with that and manage that at a lower level. That goes to children or adults in that vulnerability. We've got to learn from what we've experienced recently is joint working on a more integrated basis, be it the very front line or in a strategic planning sense, actually makes a difference to the people who should matter, and that's the people who are the children, the families, or the adults who need help. So for me, I don't think there'll be a difference in thresholds, but there needs to be some conversation about how you manage positively risk and how you get services in quicker.
Yeah, thank you. And so Simon, over to you. Just briefly, what do you think the legacy of COVID-19 will be on social care from your perspective?
Yeah, I think there will be a couple of things really spring to mind, and certainly from conversations that I've been having with providers, local authorities in the last few weeks. I think how the health sector and how councils view the social care market will have to drastically shift. You know, we've had this view, and you know, it's been kind of perpetuated in the media and everywhere around us, particularly in the UK, that you know, social care is almost secondary to health. It's not. It hires more people in its workforce than the NHS does. It provides support to more service users, more individuals than the NHS does, and longer term support as well. It's an incredibly important part of the market, and I think that we need to think about the impact on what people coming out of the market. Capacity has been a problem in particularly the traditional kind of residential home care market for a long time. And partly around funding, partly around productivity and efficiency, but I think a big thing is around how we commission care and how we look at what we want in terms of outcomes for individuals. And we haven't quite cracked in the sector as a whole how we sort of bottle an outcome for an individual and say that's what we want for that person in 6 weeks or 12 months time, and that's the level of independence that we want them to get to, and this is the value we place on that, because this is the value we place on what we can do with that service and with that group of individuals. So I think we need to think a lot differently around that, and I think another big part of that is self-funders. So local authorities and paid for care isn't the only part of the market. There are self-funders in the market that have regulated activities delivered to them, and they have more choice, they have more options traditionally, you would expect than a local authority funded customer. But actually they've also got the option or more flexibility to deselect themselves from care. And that is going to have a huge impact on the market. If you talk about, how can providers cope with a certain level of providing a certain level of capacity, particularly in a residential home, where you might have, half of your beds vacant, for one reason or another, moving people out and other things. You've got to think about how you keep that sustainable, but also how you use that capacity in a different way. Look at reablement beds, those kinds of things. I think the workforce is part of that as well. So workforce in social care isn't necessarily treated the same, doesn't necessarily have parity with healthcare, and you've got to think about how attractive that industry is, particularly if you think, do I want to go into a care home when I know the risks? Do I want to deliver home care when I know the risks? And do my clients want home care? Do they want someone coming into their house as well? And I think we're going to have to do a lot of work around, the attractiveness of that as a proposition for a job, but also, how it's funded properly as well.
Thank you, Simon. Well, that hour went particularly fast, so we've come to the end of our time together now. So I just want to say thank you to all of our panelists in today's webinar. So just to bring things to a close today, I think it's fair to say from everything we've heard today, the social care system was facing a lot of challenges before COVID, particularly around staffing and particularly around the budget constraints and the demand and the supply within social care. I think we've heard some really, really great points today around the fact that the crisis has accelerated change and has forced change upon us in a system that sometimes has been less receptive to change and less welcoming to change in the past. And that change has been positive, and there's been positives and negatives, but obviously there's a need for a period of reflection on the back of this to work out how we then take those positives forward into our transformation that we're delivering across social care. And just to Kirsty's point that she made there, that hopefully a positive lasting legacy of COVID-19 is the forcing together of health and social care into much closer working, which Sue alluded to being a really positive outcome of this, is around people working closer together in the system to deliver those outcomes for the individuals, be that children's or adults. And then finally, just summarising there from the point around Richard, that technology has a real valid part to play in this. Nothing new there from a technology, but around that adaptation of technology and also people being receptive to how that technology is used to deliver those outcomes for their patients and for their service users. And then finally, from Simon's perspective, there are some really valid points there around that workforce and around what that future workforce needs to look like and be to deliver those outcomes as we start to see us come out of, I dare say the term normal in case Sue tells me off, but into the new normal following on from this, and how we meet that demand, an unprecedented demand we're likely to see. Really interesting topic, everyone. This webinar will be available following on from today, as will the rest of the questions that we unfortunately didn't get round to answer it. But once again, thank you to all of our panelists for a really entertaining and interesting set of discussions. Thank you very much, everyone, and have a good day.
Thank you.
Thanks.